Welcome today. We're going to spend just a few minutes here today, maybe talking about medicine in the Mexican War, and as it pertains specifically to the Mormon Battalion. Just a little background on the medical uses and techniques of the Mexican War time period. There were two basic disciplines in the medical field at that time. One was the surgeon, and you can see over here a set of surgeon's tools that would have been issued to a surgeon in the Army. They consisted of tools used mainly for the main operation of amputation. Other tools were used for maybe lancing things and smaller operations, but nothing internal, certainly in the surgery at that time. But this would be a surgical kit there. The other branch of medicine that was used at that time was the physician. A physician used herbs, plant material, mineral medicines in order to prevent or cure diseases. So what I have here is a sample of some of the different kind of medicines they would have used at that time. These are kind of the mineral medicines that would have been used largely by a physician. Physician is university trained. A surgeon was apprenticed. They would simply apprentice themselves to another surgeon, and after they were kind of qualified, then they would get their certificate to practice. And by the 1840s, in the time of the Mexican War, these two had somewhat merged. So you have, for instance, in the Mormon Battalion was assigned a surgeon, Dr. Sanderson. He would have had a surgical set, and he would have also been prescribing as a physician. Now, Dr. Sanderson has a reputation or nickname that is ascribed to him of being Dr. Death. And I think an unfair nickname that he was given. But, and we'll kind of go why of that. Why was he referred to as Dr. Death? He was prescribing medicine, I feel, in the way that was very normal in the day. If anything, he was a little progressive. In this time period, we're coming out of a time period that goes back into the time of Hippocrates, where there were three ways of curing things. They felt that the body, as a holistic unit, had to be brought into what they called a balance. It'd be like someone today being bipolar and having chemical issues in their brain, and we try to balance the chemicals of the brain to make it function properly. They try to do this through the whole body by puking, purging, or bleeding. Now, bleeding was still in use, even though it was fallen into some disfavor at this time by many of the doctors and physicians of the Mexican War period. Dr. Sanderson was progressive enough that he never bled. That was not something he did. But the one thing he still used quite a bit was the purging, the cathartic action of certain chemicals. This brought him in conflict with members of the Mormon Battalions. They were coming from a background where they had a real fear of mineral medicines. The medical techniques they were using in Nauvoo and the church members at that time was a system of medicine called Thompsonian medicine. Thompsonian medicine consisted of using herbs and gentler, more kind methods. Now, when you really study it, it really is not effective, but that's beside the point. But that was the basis of their medicine, was a kinder, gentler herbs, teas, things of that nature. The main medical community was still using a lot of mineral medicine as well as that, and they were told not to take medicine like this, to use herbs and things. So that was kind of their following that counsel from their leader. And Dr. Sanderson's coming in with the authority of a surgeon in the Army, which is almost absolute. Even over the commanding officers, the surgeon had a certain level of power and control over the unit. And when men would come to Dr. Sanderson on sick call in order to be relieved of duty for the day, he would prescribe them with a medicine, and this was the one that he got him in the most trouble reputation-wise in later years, called mercurous chloride, or calomel. Mercurous chloride is a cathartic that actually purges your system. Taking in small doses will pass rapidly through your system. It is not water soluble very well, so it doesn't absorb into your system real well. If it gets damp or hot, it goes from a compound called mercurous chloride to mercuric chloride. And that is very soluble in water, and when the human body will absorb the mercury from that, and that's where calomel got its reputation of being something of a poison. Every indication is, in the studying that I've done on Dr. Sanderson, is he was prescribing this properly by giving it to them in a dry powder and telling them to mix it with their tea and liquid and then taking it that way. As he was prescribing this, and the men of course didn't really want to take it, they would get their dose, and as they were walking away from Sanderson's tent, they would simply discard the medicine. And now this infuriated him because, of course, as an Army surgeon, he had a limited supply of medicine. He had a very long trek he had to be accountable for. And so he made sure that when he prescribed it after that, the men were forced to take it. He didn't want them just wasting the medicine and not taking it as indicated. So a real famous incident that he has is a case of Private Alva Phelps, where he came in there with a complaint, and Sanderson prescribed the calomel, but he forced him to take it mixed in a rusty old spoon, as if that was some kind of a deadly thing. But he mixed the medicine and forced it on Alva Phelps, and then a few hours later Alva Phelps died. So many of the men felt that he had killed Alva Phelps, which of course medically speaking isn't the case at all, because the calomel wouldn't kill you that quick. But it kind of set up a reputation of conflict that happened. Now in the Mexican War, a typical infantry regiment brought into service and lasting for a year in service would have a casualty rate, death from disease, of around 17 or 18%, which means in the Mormon Battalion the death rate would have been 85, 90, upwards of 100 men would have died of disease. And in that year enlistment of the Mormon Battalion, under the direct care of Dr. George Sanderson, 2 or 3 men actually died under his direct care, which puts the percentage down under 1%. So the allegation that he was trying to kill the men of the Mormon Battalion with using this type of medicine was completely unfounded. Another medicine that was the mainstay at the time was quinine sulfate. This comes from the bark of a tree down in South America, Peru primarily. It's a fever reducer. Sanderson would have had a very generous quantity of this issued at the time. It was probably the most widely prescribed medicine of the day. And as the battalion went on, they were drinking out of contaminated water sources. One journal entry talks about drinking water out of a buffalo water. And you can imagine the effect that would have, and the fevers and things that they got. And Sanderson at some point apparently probably ran out of quinine, and he used a substitute that was medically accepted at that time, which is called arsenic, believe it or not. Arsenic in very small doses was a fever reducer. It was used as a medicine in many things, still in the modern pharmaceutical stores in a hospital. It does have curative properties in some areas, but it was used as a fever reducer. Very small doses. The doses would not accumulate enough to actually kill anybody, but later on, the mere fact that he was prescribed arsenic in any way, shape, or form, again, kind of led to that label of being Dr. Death, although there's no indication, of course, that that happened at all. So Dr. Sanderson, as a physician in the Army at the time, really was a progressive physician. He gave excellent care to the men as he understood it at the time. Nothing out of the ordinary. It was the same treatment you would have got anywhere in the world. Probably better than many doctors would have been. When he left the battalion, he was actually assigned to General Fremont and came back with the expedition that brought him back for a court-martial. But Sanderson was held in such high esteem by the military at that time that he was actually assigned to General Fremont as a personal physician. So I think his reputation of being Dr. Death is really unfounded, and an exaggeration that came about a little bit later. And actually the care that he gave the men was very typical and above board at the time, actually, very progressive care. And so I think his reputation needs to be kind of reevaluated at times and give him the credit he's due. A good doctor doing the best he could with the knowledge that he had in the time period that he practiced medicine. But that's my evaluation to take on Dr. Sanderson.
Didn't the battalion members have a natural bias based on the death of Alvin Smith and also the fact that Dr. Sanderson was a Missourian?
The big conflict that was really between the members of the battalion and Sanderson really probably goes back to 2 things. One, that he was from Missouri, and of course with the conflict the church had members of the church with the people in Missouri being thrown out, that was a natural suspicion that came on anybody from Missouri. And then the The brother of the founder, Joseph Smith of the LDS Church, Alvin Smith, had died after receiving a large dose of calomel. And this dose of calomel was what they called a heroic dose, meaning rather than the 2 or 3 grains you'd normally get, it was in the 12 or 15 grain range. One dose was given as the only indication I've ever seen, and he died a day or so later after taking the calomel. And as they did, they attributed this to him as the cause of death. So there's a real bias by the people against the use of calomel by members of the battalion going into it. So the fact it was just being prescribed was for anything was kind of went against their background, their experiences, and their advice that they had received. So it put them immediately, the members of the battalion and Dr. Sanderson, in a conflict, not necessarily just of his making, but also of theirs. And he had the authority to oversee the situation, and they had to take his treatment, which they resented, based on historical problems they had and this natural resentment they had of him being a Missourian.